السلام عليكم، يعطيكم العافية جميعا. معكم يحيى الشقيرات من دفعة مجد سنة رابعة، وإن شاء الله اليوم راح أكون معكم بشرح المحاضرة رقم 18 من مادة الإيميونولوجي، واللي هي عنوانها Congenital and Acquired Immunodeficiencies. قبل ما نفوت بشرح المحاضرة بدنا نشوف الأشياء اللي راح نمر عليها خلال هذا الفيديو، وإن شاء الله ما راح أطول عليكم. بداية راح نعرف شو هو الإميونوديفيشنسي ونذكر أنواع الإميونوديفيشنسيز. راح نتطرق أكثر لبرايمري immunodeficiencies، وراح نحكي بنهاية المحاضرة عن progression of HIV which is Human Immunodeficiency Virus، وراح نحكي عن مواضيع أخرى تتعلق بالimmunodeficiency. لنبدأ. قبل ما نحكي عن types of immunodeficiency، شو يعني immunodeficiency؟ Immunodeficiency is a weakening in the immune system that allows infections and other health problems to occur more easily. فهو ضعف في جهاز المناعة يسمح للinfections و other health problems to take place in the body. There are two types of immunodeficiencies. One, the primary, which is also known as congenital, that happens due to genetic defect، يعني بسبب familial history. The second type of immunodeficiencies is the secondary. The other type of immunodeficiencies is the secondary. The secondary, which is as opposite to the primary one, is acquired. And the most common causes of secondary immunodeficiency is one, malnutrition, then DM, which is diabetes mellitus. The third one is the HIV, Human Immunodeficiency Virus. هسه بيجي واحد بيسأل كيف ممكن المالنوتريشن اللي هو سوء التغذية يعمل عنا immunodeficiency؟ ببساطة مثل ما كلنا بنعرف إنه الجنين أو الفيتس أو حتى newborn babies النوتريشن إلهم مهم جدا to develop the various body systems including the nervous system, cardiovascular system, almost all of the systems including the immune system. So if the fetus didn't get the right nutrition that is needed, he will develop immune deficiency. The secondary immunodeficiencies are very common as opposite to the primary one, which is very rare immunodeficiencies. The secondary immunodeficiencies can also happen due to chemotherapy. Chemotherapeutic agents is known to lower the body immune response. Also, the organ transplant, where we as doctors give the patient immunosuppressants to prevent rejection, right? Excellent. The first entity of primary immunodeficiencies is chronic granulomatous disease. خلينا نفهم الاسم بعدين نشرح عنه. Chronic, we all know what chronic means. It means that it persists for a long time. Granulomatous, it means it's responsible for developing granulomas. طيب شو هي granulomas? It is a collection of immune cells, especially phagocytes, that cluster when they cannot kill pathogens. طب ليش these immune cells cannot kill pathogens? Due to a problem in respiratory burst. What is respiratory burst? It is that process responsible for releasing of reactive oxygen species like superoxide anion and hydrogen peroxide, especially the NADPH oxidase enzyme that is present in phagocytes like neutrophils and macrophages, responsible for killing the pathogen after phagocytosing it. So if this whole process is defected, those immune cells will not be able to kill the pathogen, so they cluster together to form a granuloma that appears in the body as you can see in this picture, form of acne or skin rash throughout the body. This disease is very rare, as well as other primary immunodeficiencies as we discussed before, and so there is a defect in killing of bacteria and fungi engulfed by neutrophils or phagocytes. فالمشكلة عندنا هون مش إنه ما في cells أو ما في engulfing the cells، لا، neutrophils and macrophages are able to engulf the pathogens but they cannot kill them. The NADPH oxidase in them is defective. كيف إحنا ممكن نشخص مريض chronic granulomatous disease? Previously they used to do nitroblue tetrazoline test. بيجيبوا عينة دم المريض وبيحطوا عليها nitroblue tetrazoline material أو solution. فإذا الوايت سيلز ما صارت بلو اللي هو نفس اللون المحلول بيكون عنده chronic granulomatous disease. The normal findings of nitroblue tetrazoline test in a healthy person is that when it is added to the blood sample, it will turn blue. Whereas in chronic granulomatous disease patient, white blood cells will not turn into blue. Okay? Now we use flow cytometry. 2/3 of this condition is X-linked recessive and 1/3 is autosomal recessive. Okay? Let's move on. The second entity of primary immunodeficiencies is the complement deficiencies. As you all know from your previous lectures that the complement system is composed of various proteins, being the 9 central components from C1 to C9, in addition to some regulators and inhibitors. Main topic today is that the complement system is of 2 pathways, the classical pathway and the alternative pathway. If the components of the classical pathway like C1, C2, C4 are deficient, it will lead to immune complex disease. Okay? If the alternative pathway components like factor D and factor B are deficient, that leads to infection with pyogenic bacteria. ايش يعني pyogenic? It relates to pus formation and Neisseria species infections, but no immune complex disease. هاي مهمة لغاية الامتحان، إنه بيجيبك السؤال كالتالي: Immune complex disease is seen in classical pathway components deficiency. True or false? True طبعا. It is seen in the classical pathway like C1, C2, C4 components deficiency, but it is not seen in the alternative pathway. انتبهوا لهي النقطة. بالمقابل إذا في عنا C3 deficiency, it leads to infection with pyogenic bacteria and Neisseria species, sometimes also immune complex disease. يعني بتشمل هاي الجهة وهاي الجهة. C3 deficiency. The membrane attack components, which are C5, C6, C7, C8, C9, their deficiency leads to infection with Neisseria species only. No immune complex disease. Okay? All components reported deficient. هاي بحال من الأحوال ممكن all components of the complement system to be deficient. ممكن تكون early component deficiency that leads to pyogenic infections and autoimmune disorders, as we just said here. Pyogenic means related to pus formation. Pus means dead bacteria and dead neutrophils. Pus is formed from bacteria and dead neutrophils. Autoimmune diseases are due to failure of the immune complexes clearance. فإذا كان في عندنا immune complexes والجسم مش قادر يعملها clearance, that will result in autoimmune disease. الجسم يعني بيهاجم نفسه لأنه هاي immune complexes مش قادر يعملها clearance. Late components deficiency leads to Neisseria infections as well as other pyogenic bacteria, as we said right here, but no immune complex diseases. Okay, great. The third entity of primary immunodeficiencies is leukocyte adhesion immunodeficiency. طيب نحلل الاسم مرة ثانية. Leukocyte means white blood cells. Adhesion معناها الالتصاق بإيش؟ blood vessel wall. فاللeukocyte adhesion immunodeficiency is a rare inherited immunodeficiency that results in immune cells fail to bind to blood vessel wall, so they cannot reach the site of inflammation or the tissue injury caused by mutations in genes coding for integrins and selecting ligands. ففي عندنا mutations للجينز اللي بتعمل coding لهاي الانتجرينز والسلكتنز، فبكون في عندنا defected adhesion. Leukocytes do not bind to the vascular endothelium and not recruited to sites of infection. فما بروح على sites of infection فما بيعملوا immune response. This case happens in severe combined immunodeficiency patients اللي أخذتوها بالبايوكيم مع الدكتور محمود الفقيه أتوقع. And we also have mutations in adenosine deaminase and ZAB70, RAG1, RAG2 deficiency. All of them results in leukocyte adhesion deficiency. Okay? Di-George syndrome is a condition present from birth that can cause a range of lifelong problems, including heart defects, learning difficulties. السيفيريتي في هذا المرض تختلف من شخص لآخر. بعض الأطفال بيجوا بيكونوا severely ill and very occasionally may die from it. يعني في ناس قليلين بيموتوا من وراء هذا المرض. و many others grow up and without realizing they have it. It is variant. It is caused by deletion of the short arm of chromosome 22. هون كروموزوم 22 لما يكون في عندنا بالشورت arm deletion بصير في عندنا Dye-George syndrome. The mnemonic of Dye-George syndrome is catch-22. Catch-22, the patient of Dye-George syndrome will present with cardiac abnormalities, abnormal facies, thymic absence or abnormality, T-cell abnormality also, يعني 2 T's عندنا, cleft palate, hypocalcemia, it happens in chromosome 22. So we have thymic hypoplasia. Thymic hypoplasia will induce hypocalcemia. Hypocalcemia will induce neonatal seizure or tetany. زي ما بتعرفوا, calcium is important to prevent tetany or seizures. We have also congenital heart defects and abnormal facies and cleft palates. المشكلة بتكون إنه بصير في عنا inappropriate development of the third and fourth pharyngeal pouches. هاي بالembryology. Manifestations بيكون في عنا absent thymus gland, no thymus, no shadow on X-ray. المفروض لما تعمل X-ray just X-ray للpatient ويكون ظاهر فيها the shadow of the thymus gland. فهم بيكون no shadow, leading to T-cell defects but normal B cells. So a patient presented to you with just X-ray, absent shadow and normal B cells but absent T cells or defect in T cells. As you all know, thymus is responsible for producing mature T cells. Also, it may present with absent parathyroid glands responsible for producing adequate calcium. So we will have hypocalcemia and tetanus or seizures. Congenital heart diseases, dysmorphic features in the heart. Wiskott-Aldrich syndrome, هيك لفظه, Wiskott-Aldrich, is a rare genetic immunodeficiency where the bone marrow of the child does not produce platelets, making the child prone to bleeding. So mostly occurs in males because it is X-linked, and it results due to a defect in actin cytoskeleton, and the bone marrow is unable to produce enough platelets, making the patient more prone to bleeding. Wiskott-Aldrich syndrome will present with eczema, thrombocytopenia, immunodeficiency syndrome. فعلى الجلد بتلاحظ rash, that is like eczema, atopic dermatitis. بالنسبة للcytometry راح تلاحظ microthrombocytopenia, which means very few platelets. And of course we have a problem with the immune system, repeated infections due to problem in the bone marrow producing platelets that results in making the child or the patient more prone to infections. Wonderful. Congenital diseases that affect B cells. We have 3 entities. The first one is Burton disease. Burton disease, also known as Burton A-gamma globulinemia, برضو يعرف ك X-linked A-gamma globulinemia, is an inherited immunodeficiency disorder that is characterized by absence of mature B cells, which in turn leads to severe antibody deficiency. فإحنا ما عندنا mature B cells، فهذا الإشي راح يعمل لنا severe antibody deficiency و recurrent infections. شو المرض اللي كان فيه عندنا absence of mature T cells؟ قبل شوي حكينا. Excellent. Dye-George syndrome. So in Burton's disease we have tyrosine kinase mutation. This is the Burton A-gamma globulinemia. As you can see here, it is an X-linked disorder. This is the chromosome for a female carrier of Burton A-gamma globulinemia, and this is the affected male of a patient of Burton A-gamma globulinemia. The second entity of congenital disease affecting the B cells is the common variable immunodeficiency. We have normal B cell count, but no antibodies. This entity is related to getting infections in the ears, the sinuses, and the respiratory system as well. The third entity, which is selective IgA immunodeficiency, is a genetic immunodeficiency, of course. It is a type of hypogammaglobulinemia. Those patients of this disease lack immunoglobulin A, that it protects against infections of mucous membranes, also lining the mouth, the airways, and the digestive tract. Okay, let's move on. The last topic of today's video is about the human immunodeficiency virus. First, we will talk about the progression of human immunodeficiency virus. كيف تتطور مراحل الإصابة من مجرد الدخول هذا الفيروس للجسم، وراح نحكي عن طرق دخول هذا الفيروس للجسم إلى وصولنا لمرحلة الإيدز which is the Acquired Immunodeficiency Syndrome. هسا ال HIV بيفرق عن الإيدز. في عنا acute infection of HIV that can be encountered وممكن تروح لحالها، لكن وصولنا لمرحلة الإيدز هذا بتطلب عدة مراحل الآن راح نحكيها. First، أول إشي لما يفوت الفيروس على الجسم راح يصير في an infection of the mucosal tissue where it is the urethral tissue of the genital tract in females and males. Then progression of the death of the mucosal memory CD4 plus T cells. فالفيروس هذا راح يهاجم ال CD4 plus T cells helper cells T helper cells، راح يهاجمها بهذا الميوكوزال تيشو اللي فات عليه. بعديها راح يصير في ترانسبورتيشن للفيروس من هذا الميوكوزال تيشو اللي فات عليه ل the nearby lymph node، وهناك راح يهاجم التي سيلز الموجودات بهاي الليمف نود. بعدين راح يصير في عندنا انفكشن بالليمفويد تيشوز disseminated بالليمفويد تيشو عن طريق الليمف راح ينتقل. بعديها بيروح على الدم بمصطلح يسمى الفيريميا. السفكس ايميا is related to blood، فلما نقول مثلا عندنا هايبرغلايسيميا معناها عندنا ارتفاع بالجلوكوز بالبلد. ففيريميا it is the increased amount of viruses in the blood. فهنا صار في عندنا dissemination of viruses into the blood. بعديها بما انه صار بالبلد فمعناته انتقل لسائر الجسم throughout the body. بعديها الجسم يصير في عندنا immune response من البي سيلز والتي سايتوتوكسيك والانتي بوديز اوف ذا بي سيلز، لكن زي ما بقولوها عبثا تحاول. بصير في عندنا establishment of latency and chronic infection. إذا صار في عندنا هون chronic infection هاي مرحلة ما قبل الإيدز اللي هو الأكوارد immunodeficiency syndrome، ما قبل الإيدز. بعدين بصير في عندنا other microbial infections. هنا مثلا إذا صار عندنا أي infection عارض راح يؤدي لإظهار السيمبتومز اللي توحي وتظهر بأنه عنده هذا الشخص Acquired Immunodeficiency Syndrome. فإذا صار عند هذا الشخص أي انفكشن راح يصير في عليه أعراض ويروح يفحص يكتشف إنه عنده Acquired Immunodeficiency Syndrome in the last stage. ال HIV Mode of Transmission، كيف بنتقل ال HIV للإنسان؟ عن طريق 5 pathways. 1 blood transfusion، ممكن شخص طبيعي يأخذ دم، يحتاج دم من شخص آخر يكون مصاب ب HIV فيروس وينقل له الفيروس من دمه لدمه ببساطة. الشغلة الثانية ممكن عن طريق نيدل ستيك ممكن انت هاي معرضين احنا لها كأطباء وطاقم طبي، انه غدا بكرة اذا انت بدك تعطي ابرة لمريض جرحت نفسك بعد ما انت اعطيته الابرة، ممكن هو يكون عنده HIV فيروس وانتقل الك بمجرد بس بروتوكول طبي. الشغله الثالثه ممكن عندك نيدل شيرنج ان اي في دراج ابيوز، الاشخاص اللي بيتعاطوا المخدرات وبيتشاركوا بالاي في دراجز هذول معرضين للاصابه ب اتش اي في فيروس. فيرتيكال، المقصود بفيرتيكال مش شرط بالاتش اي في انفكشن، وين ما تسمعوها الفيرتيكال ترانسميشن vertical mode of transmission relates to the mother giving the virus or the infection to the baby. الأم الحامل بتعطي المرض لابنها. مش بكل الأمراض لكن بالاتش اي في one of the modes of transmission of the HIV virus is vertical, meaning from the mother to the baby. Finally, the sexual intercourse. Now, the immune response to HIV infection. بعد ما يصير في dissemination للفيروس throughout the body، كيف الاميون ريسبونس راح تكون للاتش اي في؟ اول شيء اللي هو cytotoxic T lymphocytes هي CD8 positive راح تكون detectable by 2 to 3 weeks after the infection. ف it is too late. Peaks by 9 to 12، يعني reach the peak أو تصل إلى القمة من الاميون ريسبونس ب 9 ل 12 أسبوع after the infection. 10% of cytotoxic T lymphocytes are HIV specific at 12 weeks لأنه هون وصل البيك. ف 10% فقط منها بتكون specific لل HIV و not enough of course. The hormonal immunity peaks at 12 weeks as well. Anti-envelope antibodies will be seen after 8 weeks. طبعا ال HIV virus is a retrovirus and it contains reverse transcriptase. It is a D-type virus. وهي المعلومات على الأغلب تكونوا عارفينها من الميكروبيولوجي، لكن مش مهمة حاليا بقدر إنه نعرف immune response to HIV. The later anti-P24 antibody will be seen in the blood. راح يكتشفوا في أن بعد هاي المدة يصير في antibodies against P24. والeradication of the viruses cannot be done efficiently لأنه يتم اكتشافه أصلا أول ما يتم اكتشافه by cytotoxic T lymphocytes بعد 2 to 3 weeks of the infection وبيكون already disseminated throughout the body وبيكون في عنا viremia. ف it is too late. The phases of HIV infection are 3 phases. The acute HIV disease which is the infection itself يعني الإصابة بالفيروس بحد ذاتها. لسه ما وصلنا مرحلة الإيدز. الإيدز Acquired Immunodeficiency Syndrome is the last stage. تفرق عن ال HIV infection. وهنا بكون المريض contagious بمرحلة الأكيوت HIV disease. لسه تو ماخذ الانفكشن ممكن يعملها spread للأشخاص اللي حواليه عن طريق زي ما حكينا needle stick أو sexual intercourse أو IV needle stick برضو. The immune system is fighting the virus in this stage. وهي بتكون عبارة عن 2 to 4 weeks after counteracting with the HIV virus infection. The second one, which is the clinical latency period. The clinical latency period هون T helper cells is decreasing slowly. يتم مهاجمة ال T helper cells من قبل الفيروس. بانتهاء هاي الفيز this clinical latency period the constitutional symptoms appear and clinical latency period can last for decades. ممكن تقعد عقود كاملة اللي هي chronic HIV infection after the acute infection. The final stage which is the AIDS, the Acquired Immunodeficiency Syndrome. CD4 T helper cells are declined significantly يعني بيكون below 200 cells per millimeter cubic. وهون المريض بيكون vulnerable to opportunistic infections وأي ميكروب صغير ممكن يعمل له infection فما عنده cellular immunity بالمرة. وهون بيكون عرضة للopportunistic infections وبرضه للكانسر. الsymptoms of acute HIV infection بيكون في عنا fever، بيكون في عنا chills، ممكن headaches، night sweats، sore throat، muscle aches and pains. this is important. muscle aches and pains. joint pain بتكون موجودة fatigue. but all of these are general except for this one and this one which is swollen lymph nodes mainly in the neck as you can see and the mouth ulcers. Some patients may experience no symptoms at all. This is the symptoms of acute HIV infection. بالنسبة للأكوارد immunodeficiencies هون موجودات بهذا الجدول حط لكم إياه الدكتور، وأهم وحدة اللي هي ال HIV حكينا عنها، والباقيات تقدروا تشوفوها، تشوفوا الميكانيزم على السريع. في عنا مثلا removal of the spleen. removal of the spleen هون the spleen is responsible for the synthesizing of various types of immune cells. ففي عنا decreasing the phagocytosis of microbes especially T cells. وفي عنا هون بهذا الجدول clinical features of HIV infection زي ما حكينا. في عنا acute HIV disease، في عنا clinical latency اللي ممكن تستمر لعقود لمدة طويلة و it's variant between people, and we have the AIDS which is the acquired immunodeficiency syndrome. وهاي ممكن الأشياء اللي بتصير after the stage of AIDS like an opportunistic infections like protozoa, bacteria, fungi, viruses and tumors as well including lymphomas, Kaposi sarcomas, encephalopathy and wasting syndrome. And Kaposi sarcoma is actually very important in relating to patients who have acquired immunodeficiency syndrome. هيك بنكون وصلنا لنهاية الفيديو. الله يعطيكم ألف عافية وبالتوفيق بامتحانكم.